Hello friends, now we'll be seeing a topic of renal cysts and benign renal tumors. So before starting, I would like to thank Chandana Shri Ma'am for sharing these wonderful notes with us, which are very helpful for quick revision. The link for the notes is given in the description below. You can download it from there. Also, you can join my Telegram channel for notes on other topics. So without further delay, let's get started. So renal cyst can be genetic, that could be ADPKD or ARPKD, polycystic kidney disease, or it can be sporadic or acquired, that is acquired cystic kidney disease. Now you'll see the Bosniak classification which helps in evaluation of renal cyst, along with that characterizing and assessing the risk of malignancy. So type 1, which is around 1.7% chances of malignancy. So these have simple benign cysts with thin walls. There is no septation, calcification or solid component. So we have to take a note that there is no septation, calcification or solid component. As we can see in the diagram, these have thin wall without any septation or calcification. Then we have two which has 17 to 20% chance of malignancy. So these will also have thin wall, but they will also have, along with that, thin septation and fine calcification. There will be minimal wall enhancement and the size will be less than 3 centimeter. Then coming to, and these two have very minimal chances of malignancy, almost 0%. Then coming to the third one, that is 2F. So these have complex cyst requiring follow-up. They will be having cyst that is more than 3 centimeter, and they may having hairline septate which have increased thickness over time. So these need follow-up, and here they have 5% chances of malignancy. Then the next one, where there is indeterminate thick septa, thick wall with measurable contrast enhancement of these walls. They have 50% chance of malignancy and they require active surveillance or even excision and ablation. Lastly is fourth type, where they have thick septate, irregular wall and soft tissue necrosis. These are mostly malignant 100% and require excision or ablation. What are the indication of surgery in these renal cysts? So one is the risk of malignancy. Other than that, there could be symptoms like pain in the flanks, infection causing fever and pain, hypertension, hemorrhage into the cyst, traumatic rupture causing pain. So all these symptoms are indication for surgery in these cysts. What are the various procedures we can do? So we can go with aspiration, decortication, resection, sclerotherapy, arterial embolization and nephrectomy, which would be partial. Then coming to the solid benign tumors. In solid benign tumors, we have oncocytoma, firstly, which is the most common benign enhancing renal mass. And histologically, sometimes it is similar to chromophobe RCC, and it can be distinguished with help of immunohistochemistry. It is associated with Burt-Hogg-Duke syndrome, which has pulmonary cyst, spontaneous pneumothorax, and fibrofolliculomas. And these will need active surveillance, sometimes biopsy and partial nephrectomy. Then coming to angiomyolipoma AML, that is a benign tumor composed of dysmorphic blood cells, smooth muscle and adipose tissue. It can be sporadic, sometimes it is syndromic, and they syndromic, it can be associated with tuberous sclerosis complex or lymphangioliomyomatosis LAM. Imaging is done, that is MRI, which is investigation of choice, and fat poor AML may sometimes mimic as RCC, so we have to be careful in that. Management is depending on size and symptoms. In case of bleeding, we can go for angioembolization. If there is chance of malignancy, nephron sparing surgery, nephrectomy. Multifocal syndromic disease, we go for medicine that is everolimus, with that is mTOR inhibitor. And third one is the papillary adenoma of kidney. So these are well circumscribed cortical lesion, generally of size less than 0.5 and similar to papillary RCC and have common lineage. So pre-malignant, so may need resection. Then metanephric adenoma, which is rare and seen in males more commonly and exist on a continuum with the Wilms tumor or papillary RCC, so may need excision. Apart from that, we have cystic nephroma, mixed epithelial stromal tumors, leiomyoma, reninoma. All these are rare tumors. So this was all about renal cyst and benign renal tumors. So if you have liked the video, please like, share and subscribe. And the link for the video, link for the notes is given in the description below. Also, you can join the Telegram channel for these notes and for other notes. And never give up, because great things take time. Keep studying, keep growing, because knowledge is power. And see you soon in next video. Thank you.